Are you feeling pain in the lower back first thing in the morning, stiffness in the joint and your lower back clicks? That might be the SI joint. Now how to fix it is in this video. So without any delay, let's dig into it. Mostly what happens is the SI joint is the joint between the sacrum and iliac, and this creates a lot of mobility while sitting, or if you're pregnant, or if you fall on the back, then it strains that joint. Hi, my name is Rakesh and I'm a physiotherapist. I see a lot of SI joint patient in Edmonton, Alberta. What works really good for the SI joint issue is combination of mobility and stability exercise. Most of the time, if you keep strengthening, it will not work, because strengthening just not fixing the whole issue, because some tightness in the muscle is also need to be addressed. In this video, we are going to discuss 4 stretches and 4 strengthening exercise that you can combine and you can see the good result. So first stretch is sideline trunk rotation. SI joint is a rotation joint and rotation is important. That's why the first exercise is a trunk rotation. This is called open book, close book exercise. So you lay on your side and then bring your both hands together in front of you. Bring one leg in front of you as well, and then we are going to bring top arm backward by rotating the upper body. Once you rotate the upper body, it helps the mid back and SI joint to rotate, and we are going to do this all stretches 10 repetitions, 10-second hold, and then we are going to do on the other side. Now pause this video and do it. If you feel good, you do more reps as well, and then we are going to move to the next exercise, which is knee to opposite chest. Now this exercise is a gluteus stretch. It's the hip mobility. Gluteus are a very big muscle on top of the SI joint, and it is responsible for the SI joint stability. Now a lot of the research done on the gluteus muscle, and it is very important muscle for the hip, so we need to stretch it. How you do it is you go on your back, bring your one leg towards your chest, and then we are going to pull that knee towards the opposite chest. Hold it there. You're going to feel the intense stretch in the gluteus area, and this can be done again 10 times, 10-second hold. Stretch number 3, seated hamstring stretch. Here we are going to sit with the legs in front of you, and then you are going to straighten up the leg. As you straighten up, you are going to get a stretch which is very intense in the back side of the leg. Number 4 is the cat and cow. Again, this can be a coordination exercise or the stretches. Here we are trying to do the lumbar spine stretches to help the SI joint mobility as well. So we are going to do cat and cow. You go on your hands and knees, and then we are going to do this for a few seconds. Again, 10 reps up and down, and then you're drawing the tummy towards your floor and you're bringing the tummy towards the ceiling. This is easily done, and you can do 10 reps. Now let's talk about the strengthening exercise. The strengthening is about around the gluteus area. So first exercise is a clamshell. So for clamshell exercise, you go on your side. You can use a band or no band, and we are going to bend the knee 90 degree, hip 90 degree, and we're not moving the ankles here. We are only opening up the knee, and we're getting the gluteus medius activation. This clamshell is very good for the SI joint or any hip issues too. Again, this strengthening can be done a little bit more reps. We are going to do 10 reps of 3 sets of all strengthening exercise on each side. Next exercise is we need a gluteus activation with the bridging. So when you do the bridge, it activates your gluteus maximus. That's a big muscle. But we still want the gluteus medius, the rotators, to activate. And this is where we're going to use the band around the knee, and we're going to do bridging. And this bridging is very important for the SI joint, because it extends your SI joint and it makes the core and other extensor muscles activated as well. Third exercise is the hip abduction. This is sideline hip abduction. So you go on your side, and then we're going to make our back straight, leg straight. We're going to lift the hip on the side. So you're kicking the hip, lifting the leg on the side, and you're doing this 10 reps, again 3 sets. And you can also add the band eventually if you start feeling really good with it. Last strengthening exercise is called bird dog exercise. Bird dog is where you go on your hands and knees, and then you're going to lift one arm and opposite leg, and then activate your core, and then we're going to kick the leg back again and do both sides. So that's it for those exercises. And this exercise, there are 4 stretches. For stretches can be done 10 reps, strengthening can be done 3 sets of 10 reps. So strengthening needs to be done, and you can try this every other day or every day depending on your pain level and your capacity. Please check this video out about the SI joint. In 2023, a randomized controlled trial was done on 120 subjects with 4 different types of exercises group, and then there was enormous results, and what helped them was the combination of motor controlled exercise and balance training. So that video has a separate kind of exercise. If you like this content, check this video out. It is research based and it's based on the article. The study was done recently in 2023. Thank you again. Hope you have a good day.